Welcome to the Say Goodbye and Imagine podcast, a podcast for people interested in understanding what's possible when we remove something toxic from our lives, namely alcohol. So why would you listen to this podcast? Because in every episode, I will try to expose the lies embedded in a habit that is taking control of your life or the life of someone you care about, and show you what's possible when it's put to the side. My goal is to give you insight into the lies of the enemy when entrenched in these behaviors. I'm your host, Roseanne Forte, alcohol-free coach and best-selling author of The Plans He Has for Me Daily Devotional. I am so excited to bring to you this guest today. He is Dr. David Jenkins, and he is a professor of psychology and is the clinical director of the PsyD in the clinical psychology program at Liberty University. He has served as the clinical director of the International Board of Christian Counselors as part of the American Association of Christian Counselors, and is also on the executive board of the Society for Christian Psychology. With over 30 years of clinical experience, Dr. Jenkins specializes in the integration of Christian faith and clinical practice. He's worked extensively with addictive, mood, and anxiety disorders in the context of individual, marital, group, and family therapy. Dr. Jenkins has provided education, consultation, supervision, and training for a variety of churches, ministries, and professionals. He's also an author and speaker at conferences, seminars, and retreats. In this two-part series, I get to ask him a lot of my burning questions that I've had about the clinical aspect of addiction, the integrative model of addiction, and the history of languaging and stigma surrounding substance use disorder over the decades. I'm excited to interview him, so let's listen in. Hey, David, thank you so much for joining me today. I am super excited to have a conversation with you about a variety of things. And I met David at the American Association of Christian Counselors conference, and I just thought what he spoke on was so cool. And then we connected, and then I started taking a course through the American AACC for short. And I ran into David teaching on 4 models of addiction, and I'm like, oh, this is super cool. And you gave the history. So actually, before we even get into that, can I just find out a little bit about who you are and how you how you got interested in clinical psychology with expertise of addiction, correct?
Right.
Yeah, okay.
Sure, glad to. Well, thanks for inviting me to do this. I mean, I really appreciate the opportunity, and it's right in line with what I'm here to do. So, I mean, it could be a really long story. I'll try to keep it short. Most people, look, I've got a story, and God had a path for me, and I did my part to get on that path early on. Right, was saved early on. Grew up Christian family, great parents, not perfect family, right? Functionally dysfunctional and dysfunctionally functional, right in the normal zone. Had our own particular issues, but, along the way, found the wonders of alcohol and other things and other addiction stuff. But that landed on top of a one-time abuse incident that occurred for me. It wasn't, thankfully, this ongoing thing. It was a stranger, as a one-time deal. I already had sort of this fracture in the soul. If you think of like splitting wood, and you're using a wedge and a sledgehammer, the place where if you want to split that piece of wood, you aim for the crack in the core.
Right.
And that event put a crack in my core. And of course, I was a sitting duck for addiction difficulties anyway. Boy, so it went downhill quick. And I ended up being non-functional and was supposed to be permanently disabled,
Wow.
mental disability, stuff like that. And God saw fit to just raise me up. And he did it his way and took me a path that probably aligns with a lot of what we'll talk about today. And he did it for a reason. And I mean, I know that he took me down that path of just kind of, I've described it as the my soul, myself was pulverized. You know what I mean? It was
Mhm.
just powdered and turned to fibers, and I was just worthless. But boy, he raised me up when it was his time to do so. And
And you're
so,
talking about the addiction that drove you down into a hole, or is
yeah, it
it
was actually 3 things, you know what I mean? I think the trauma alone would have been enough, just even though it was kind of a one-time thing, trauma, all of this affects individuals differently. For me, that would have been enough. The addiction
well,
stuff
and
would have
just
been
I
enough.
did a podcast yesterday that's gonna
Mhm.
be released soon too, with a trauma specialist, and
Yeah,
man, this stuff well, I'm sure we'll get into that, but that goes
yeah.
hand in hand, trying to deal with the pain of an
Yeah.
event, and
And
that's
then
kind of
and then the whole
mine. It
mental illness
wasn't
piece.
it
Yeah,
wasn't a one event trauma, but it was over time, and
right.
yeah, so
And you can get there by way of, a small accumulation of what some people call little T trauma
that was me,
or
yeah.
some big T traumas, and it's just the individual variation that occurs with that. So anyway, got to raise me up, and gave me one of these choice points of do it, here's your way. And I saw that one. And then he said, here's my way. I knew what he was talking about, but I,
We all
but I,
do.
but I couldn't see that outcome. You know what I'm saying? And so he made me choose based on faith, not sight. And I said, look, I'm going your way. I don't care. I'm done. You know what I mean? It's over. So he raised me up. So I actually was on an 8-week summer mission debating full-time Christian ministry or pre-med go psychiatry. And he shot me right down the path of clinical psychology.
Oh, wow.
And then he threw me a curveball in the United States, mainly in the context of the church, because I was ready to stay in the boonies of Costa Rica, down in the jungles, hardcore kind of stuff. And
Is that where you were?
yeah, I was an
That's
8-week summer construction mission. And so, about the 5th week in, he made it pretty clear what he had in store for me. And so, okay, let's go. And it's been a ride. So that was 40 years ago now. So
uh,
yeah,
yeah,
it's
and
been a
you
great journey.
definitely made yourself a name, so God did have a plan.
And see, this is where this whole kind of thing fits in of what we're talking about today. I think one of the main points today is he took me a path that didn't fit what everybody said the path would have to be if I was going to quote unquote recover.
Mhm.
Um,
So I
so
just wanna
for
ask a question, how did
here,
you, quote, unquote, "recover"? What system did you use? Was it
I'll
just God
I'll tell
speaking
you,
to you?
just power of God. I changed. He put me in a context of healthy relationships, healthy environment. I started off at Montreat Anderson College at the time. It was a junior college, but a Christian college. So I just hunkered down for about 6 weeks before I went there, because I knew, man, left alone, I didn't want to do anything to slide back into what I'd already been part of, right? And I'm bragging on him, not me. Uh,
Yeah, I get it,
it was
100%.
it was just a junior college at the time, and in less than 2 years, I came out of that school with the 2 highest awards the school offers, and no student had gotten them before or since, both in the same.
Wow.
And so when that whole convo was over where that happened, I mean, the loudest message in my spirit was, "He did it. He did exactly what he said he would do." And so he raised me up and just set me on that path. And so I mean, my first quote unquote 12-step meeting was when I drove a van full of adolescents in dual diagnosis treatment to their first meeting.
Oh, wow, okay.
So I didn't go the typical recovery route. Honestly, after he healed me and raised me up from some pretty severe stuff, from just utter, destruction, that's when my professional contact stopped. So
Yeah,
all my the professional stuff kept me alive. He gave me life. And
yeah.
yeah.
And I love the fact that you use that word healed because that's what I do too. It's healed. He
That's
heals
right.
us.
Right.
So
Yeah. We have to have a lot of flexibility when we come to this whole area of, substance use, addiction, and all that, just because it's so varied of how people get there, how they get out, what happens while they're in it, and what they do once they're out of it. It's just such a varied thing that you really do. I mean, it forces us to honor individuals and their uniqueness. And we,
praise God.
yeah. I mean, we have to, and we have to really pay attention to who has he made you to be,
Mhm.
and what can we do to help you participate with him in that.
Absolutely, absolutely. So I want to do go back in time because you're so
Sure.
eloquent about, because I didn't understand any of this until you explained it to me in via a course. But the history of how we got to where we are today, because the history kind of makes sense. It follows science, it follows good intentions, it's helped people, but we're in a place where we have unfortunately stigmatized
Right.
this problem. And that is my goal, personal goal, is
Sure.
to unstigmatize it. Yeah.
Right.
So let's talk a little bit of how we got to where we are.
Sure. The first kind of modern formulations of addiction, particularly, started with alcohol and the AA movement back in the early 30s or late 30s, early 40s. Freud, of course, had, his psychosexual theory, psychoanalytic theory. So there had been moral models that it was only bad character. If we want to kind of put it into sort of religious terms, it was only sin, without a whole lot of thought to, well, sin of others, sin of self, sin in the world, broken brain and body. What kind of sin are we talking about? See, we never really did a good job of that. So that's part of what drove people underground and just left people stuck, I think, for a long time.
Didn't
Then
they
along,
put people in insane asylums back then?
sure, and when they had to go through withdrawals, of course, and one of the things we really don't appreciate today, even, is that withdrawal from alcohol is the more medically dangerous withdrawal that you can still have, because the alcohol just goes everywhere in the body, right? I mean, it crosses blood-brain barrier, the alcohol molecules bond to water and stuff like that. So it just goes everywhere. And that's why alcohol is a medically dangerous thing to withdraw from, especially if you've been drinking really heavily for long periods of time, or you've got history of when you've backed off, you start having some very uncomfortable symptoms and signs occur, the shaky, the tremors and the pain and all
Well,
that.
I was going to address this later, but since you brought it up, because my focus is primarily, clearly, people who don't need medical attention. But I
Right.
do really want to point out, when does a person know that they should deal with this medically because of the danger? How
Yeah.
would somebody know?
Well, honestly, think in terms of what is wise and what is foolish, right? I learned a while back to train myself to not think smart and stupid,
Love it.
because you can't fix stupid, right?
No.
But you can always choose to live wisely and stop living foolishly. And so I think, thinking in terms of wise and foolish. If I'm going to be if I'm going to address a a situation that involves my body and what I've been putting in my body, and it's adapted to it and all that, it's probably wise to at least let a trusted physician know that here's what I'm going to be up to. Now, you don't have to, right? I'm not giving any mandates, but just consider that possibility, right? That, especially if, when I've reduced my use before, I start having some real discomfort, that just says there's more of you involved in this, and it might be wise to have a medical professional check in.
Well, discomfort can be discouraged. That's the case for everyone with
Yeah. I mean, like,
substance
if you're
use,
really
right?
shaking and it
The
doesn't stop.
shaking, yeah,
Yeah,
that's kind of where I tell people, like, if you're experiencing DTs, I think you're safer to discuss it with a doctor than just go
Right.
cold turkey and try this challenge.
Yeah. If
Yeah.
it's just headache, something like that, and you know you don't have any other physical problems going on, but see, like if if you've got diabetes, if you've got heart difficulty, if there's any other medical situation, it's just wise to just check that out. Now, you don't have to, but wisdom would suggest if I've got other things going on and I have these other difficulties, I'd probably better get it checked out.
I
But
agree.
but again, most people on their own who at some point have, meet diagnostic criteria for some kind of use disorder, mild, moderate, or severe, right? Most people change on their own without seeking formal treatment.
Amen.
Yeah.
Thank you.
And so that's really kind of the beauty and the importance of the work that you've done is you've in your own way, you telling your own story and being faithful to do that honorably before God. This is what happens when people do that. And you have, regardless of how intentional or not intentional you were, even if you just stumbled into it, you have a truth-based book that it's it's not a it's not a surprise to me that people are responding favorably. Let me put it that way.
Right.
Just because you have been very eloquent about your journey, and at the same time, it's the truth behind that journey. See, truth is what sets people free,
Absolutely.
and that's part of what this is all about, right?
Yeah, that's how I look at it is
Right.
God's truth. It's
Right.
fessing up to the truth of what this has cost you. It's
Yep.
and it's the truth about a better plan and something.
Well, there you go, and that's ultimately where that's ultimately where we end up is the hope is an important the federal organization, SAMHSA, the Substance Abuse Mental Health Services Administration, they describe hope as it's the catalyst for the change. So the hope is the important piece, and that's where that's where we end up.
Yeah,
So hope to this changing alcohol use really started in large measure with the foundation of the AA program, and I think people are more familiar with this history now, and I'm thankful for it. Is that it was born out of Bill Wilson's and Dr. Bob's involvement in a group called the Oxford Group, which was a
Mhm.
Christian group committed to world evangelism.
Right.
And so what happened was they wanted the message to be more broadly accepted. And so they toned down the specifically Christian aspects of the Oxford Group's principles. And
Right.
those laid the foundation for the 12 steps. And of course, from that point on, it just took off. So the good news is people responded favorably and freedom came along. Part of the bad news is everybody thought there was only one way to recover. They came to believe that, even though the founders and the early people in Alcoholics Anonymous said, we don't care how you do this. We are just glad you do it. This is how we found helped us. And so
Right.
a lot of modern conceptualizations of this recovery 12-step approach, they're violating the early founders' basic assumptions of it lots of times. And so,
Yeah. I think
yeah,
and people are, a lot of people that are really against that higher power thing really want other approaches. And, there are other approaches out there. That's how I got help, right? I went through a non-Christian, other science-based change your neurological patterns type
right,
of program.
right,
But what really was the impetus to me going further with it was even though people were successful, they choose to drink again.
yeah.
And I think that is a direct relationship to not having God involved. And, why bother if
Well,
there is
and that's where the models things, kind of come in is that, you had moral approaches where it's only wrong, it's bad character. Of course, you mentioned the stigma, the shaming, and all that kind of thing. Alcoholics Anonymous and approaches like that came along, and that's where you started seeing the um, beginnings of the disease model, which took kind of the shame and the willfulness of the quote unquote disease. And I guess, all right, I'm not anti-disease model. I'm anti-disease model only.
Yeah, I know. That's
Right.
what the models are, right?
Right. Think
Yeah.
of a whole continuum of ways of approaching this. And I guess I'll go ahead and steal some of our own thunder here. And look, think biological, psychological, social, and spiritual. So bio, psycho, socio, spiritual as dimensions of these various models. And various models will focus either solely or mainly on one or more of those dimensions, right? So a
Right.
disease model, of course, is going to be reductionistic toward focusing on the biology. And so
Right.
we've got a lot of that going on now. So there's your brain disease, the disease of addiction, and those kinds of things. You've got a lot of people that will focus mainly or only on the psychological, particularly in the past. And that's where, tying back to Freud's theory, the idea of an addictive personality, that someone with alcoholism is fixated at the oral stage of psychosexual development, right? So you've got the psychological personality kinds of models, right? Then you've got social models, social influence models that come in, coping models, those kinds of things.
Well, the social model would say it's because of a history or your socioeconomic status. Would that
Yeah,
be a
modeling your relationships, the value that you get out of being with others who do it, family influences, cultural
that would
influences.
be a trauma focused model too, right? If it's a
That
trauma
could,
only.
depending on how people are viewing trauma. That's
Oh, right, because that
yeah,
could fit into the psycho
right,
thing.
right.
Okay. Trying
Well,
to figure out which
and the
corner.
bio now, and that's where we just have to be careful. We live in a
Right.
good day. It's a good time for someone to make decisions about what they want to do about their years, right? It really is a good day. We know a lot. There are a lot of resources out there to either change on your own. And remember, you making a decision to get additional care is you changing on your own.
Yeah, I love
Yeah.
that.
So all of that's available, these days. And so I'm coming from, I really think we end up now with integrated models, biopsychosocio spiritual models. And so those have helped guide our thinking and our understanding about addiction broadly, and then with specific substances. And again, alcohol being the most common. People are rightly concerned about, the opioid crisis and the overdose deaths, the poisoning deaths that have occurred, and all those kinds of things. Rightfully so.
Yeah,
But
they're all rising.
but every year, right, we've had 80,000 people a year dying from alcohol-related deaths.
I think that number's up since COVID to maybe as high as 140 the last I
Right.
saw.
Yeah, all the opioid overdoses is
Oh,
way up.
and opioid. Yeah, yeah,
Yeah,
yeah.
yeah, yeah. And so then you throw in nicotine, throw in tobacco related deaths, you're talking 480,000 a year.
Oh my gosh, I hadn't even considered that in my
Yep.
statistics.
It's overwhelming that alcohol and tobacco, the socially acceptable ones, are killing the most people and always have been, right? And
Right.
so now, coming from a biblically informed Christian worldview, it's no mystery to me why spiritual factors involved in addiction are so important to consider. Right? If I'm the enemy of God and I'm the enemy of the people who are created to be and do like Him, I'm going to tear you up, and I'm going to do so with abandon. You know what I mean? If I'm going to be an adversary that's out for your destruction, I'm going to tear you up however I can. And alcohol and tobacco socially accepted, and yet they're killing the most people. And right, we got to be wise about this stuff and holistic, right?
Yeah, I didn't only now can I look in the rearview mirror and realize how much of an idol I
Right.
made alcohol over my life. I mean, it really became I'm sure you've heard this before. Look at your checkbook
Yeah.
and see what you spend the most money on. That's your idol.
Well, and see, I think the scripture is always way ahead of us. Paul set this contrast. He said, "Look, don't be drunk on wine, instead be filled with the Spirit." And the contrast, so it comes down to whose influence or what are you allowing influence in your life, right? So rather than being influenced, controlled by alcohol, right? Don't be drunk on wine. Instead, here's the contrast, be filled with the Spirit,
Right.
right?
And I always look at that. I don't know if you probably know this. I'm really trying to change languaging, but I try not to use the word sober, not that it doesn't have a practical um use. It's
Right.
just that if people don't want stigma, they shouldn't go to a restaurant and say, no, thank you, I'm sober. Like,
Right.
just say no, thank you.
Right.
But I do bring in scripture that asks us to be sober minded,
Sure. Absolutely.
because when we're not sober minded, regardless of what we're under the influence of, we're
Right.
not behaving in a manner that is reflective of the Holy Spirit, right? So
And if
I
and if
do.
I'm already not behaving in a manner reflective of being filled with the Holy Spirit, adding any kind of substance that changes my ability to do that even more probably isn't a good idea, right?
Right. Yeah.
Yeah,
Yeah.
and that gets back to this whole idea of live wisely, right? And it also ties into if I really want to experience and share that experience of an abundant life, it's kind of foolish of me to do things that sabotage that, right?
Right.
So remember, I can correct foolish, you can't fix stupid. So I
So
can
we're all
choose.
foolish. We're all foolish.
We are, and see that alone helps remedy some of the shame when I realize everybody else is in the boat with me, you know. Um,
Yeah. But
Even once I start living wisely, I'm going to have moments of foolishness. I mean, that's just our plight right now. And
yeah. Yeah.
thankfully, God is very forgiving and loving, and so all our people in our lives and relationships. I know it's hard when you've had 30 years of somebody doing the same thing over and over again and being offensive toward, you know what I mean? I get that things don't always work the way they should. And even once someone begins living wisely, it may just be too far gone. And that's okay. We count our losses, we grieve and we do all this, but we still look forward with hope to,
What do you
okay,
mean too far gone when you say that? Too far.
um, I think some relationships don't have to be fully repaired in order to
Oh,
change.
absolutely.
Yeah. Yeah.
Absolutely.
Yeah.
I
That's
get
fine.
that so much. It is heartbreaking. I have a private Facebook group where people are like, but I just want my children to trust me again. And I'm like, give them time.
Yeah.
They
Yeah.
hopefully as you continue to walk this path and as they can trust in your ability to stay it, but right now they're protecting themselves because they've believed in you before,
Right.
but they got let down. And
And
just continue to
sometimes
walk
over
towards
and
God
over.
because that's the best way
Right.
to believe something else, something different is
Right.
possible.
Yeah. I try to look for these just very basic definitions of things because I got to keep it simple. One of the ways that helps me think about trust is consistency in behavior over time, right?
I
So
like
somebody's
that.
going to trust I'm going to act irrationally, or somebody's going to trust that I'm going to act rationally. Somebody's going to trust that I'm going to act foolishly, or somebody's going to trust that I act wisely. But it really comes down to consistency in behavior over time. And
Right.
so and that has to become kind of a stable trait of my life.
And it's
And
so hard. It's so hard for people as they're walking through, and maybe this time it's sticking. Maybe this time they're really following
right,
God and they want this acknowledgement from their family so bad. Like,
right.
I'm doing so well and nobody will congratulate me. And I'm like, I
Yeah,
I know that's heartbreaking, but they're only protecting themselves. You just got to keep walking the path and focus
right,
on you. Like,
right.
you know?
And when you can let go of that, that doesn't mean give up hope, but you just let go of that. You then start finding relationships where that does occur.
Mhm.
And the path. It's when you are most likely to just hang on to something, if that's the moment you let it go, then some things start to come into your life that otherwise wouldn't. Now, what happens is it's kind of like we do this unconscious bargaining. Well, I'm hurting so bad. Okay, I'm going to let it go. Therefore, tomorrow they're going to call me and say, let's go to dinner and repair this thing. See, that's not letting go,
Mm-mm.
right?
Yeah,
It,
it's just it's making God a genie.
yeah,
Like, that's my favorite term, making God a genie. Like, okay, fix this, and
yeah. And you just
just
got to, again, stay primarily in touch with him, your creator, and your doubts, your anger, your fears, but also your joys and successes. Primarily process those in the context of that relationship. The problem is, these journeys that we're on often shape our view of God too. And that's why trusted people, that's why the comforting but also challenging words of someone who loves people like you do are so important to have out there in the public domain. Is
right.
people who you don't even know, who you're never going to know, and people who don't know you and are never going to know you can still, hey, there's at least one person out there that knows me.
Well, and that's what I
Yeah.
think kind of is a little bit of the secret of the devotional is my ability to reiterate the pain that my my mind was going through,
Yeah.
because what we don't realize is everybody says the same thing. They're like, "Oh, I can't believe you said what I was thinking."
Right.
And this happened to me last night. I'm in a church-based trauma course to try and learn more about healing trauma.
Right.
And I was in something, and I was asked a question, and I'm like, I'm just so grateful that I don't have to say I'm unlovable anymore.
Right.
And this woman who found a horrific, like a mother who just never wanted to have children, like, you're a mistake. I can't believe
Right.
this again. And
Right.
she's like, I can't believe you just said that. And like, I'm like, I did. And I believe that to the core of my soul, that I was
Right.
unlovable.
Right.
And, people need to hear that you can get rid of that narrative and that it's not true.
Right. And it's kind of a shock sometimes to realize, and it never was.
And it never
You know
was.
what I mean? The degree to which I believed what has always been a lie, that's when I can really start feeling stupid, not foolish. You know what I mean? And see,
Yeah, it's
yeah,
a lie of massive proportions, which is what I like to say. Yeah.
exactly. And see, that has been Satan's strategy ever since the fall. His deception involved, you aren't you aren't quite what you need to be. I will offer you what it takes to then be finally fully loved and accepted by God. That was his whole deception.
Yeah.
He took the fact that the woman was created second chronologically in time,
Uh-huh.
and he went, "Well, how? did God really say this? Because, you weren't here when he gave the command. You came along, you were second. Now, chronologically, that was true.
Right.
Okay.
Well,
But the twist was, well, you being second, it was a tainted, you're less than.
right. Oh, you want to hear mine? Okay. So I
Crazy,
have this in one
crazy.
of my core concepts. It's called,
Mhm.
the truth about temptation. And I go back to that story in the garden where Eve pretty much knew what God said, right? What God says
Yeah.
is truth. I know what, and he's going, but did he really say that? Like, come
Right.
on. Like,
Yeah.
gaslighting,
Doubted
right?
doubted God's
Gaslighting.
word and doubted God's character. And that's
I
been the strategy ever since.
I look at it as gaslighting. You
Right.
know what's true.
Exactly.
And then he comes in and causes you to doubt
Right.
what you know is truth. This is
Right.
the definition
Right.
of
And
substance
and so
misuse.
the only one in that scenario that actually was there when God directly gave the command was the man.
I
And
didn't even really
and
think about
and he's
that.
standing right there watching this whole scene go down.
Yeah, he
He's
didn't.
just not intervening. And so that's when, what is this you have done? Have you eaten from the tree I commanded you not to eat from? Every one of those is masculine singular. That
Yeah,
was
see,
right
this is
smack
where
dab.
smart people come in because I didn't know
Yeah.
that. I just look at it as from the gaslighting standpoint. She
Well,
knew what the rule was. She
right.
knew what the rule was.
She knew, yeah, definitely. Yet he was held accountable. Remember? Sin came through the one man, Adam, not came through Adam and Eve by
Oh,
way of the
that's
woman, right? Not how it works.
yeah, yeah. Oh
So,
my gosh.
all right. But see that whole event really, honestly, you can overlay an addictive lens to the fall and the consequences of the fall and what happened and the distortion of two persons who were in pristine condition being created in the image and likeness of God,
Yeah.
right? You can overlay an addictive lens to that honestly pitiful scenario that we see in Genesis 3.
It's so easy.
It's
Yeah.
that they it they engaged in a form of legalism. And remember, sin from God's vantage point is lawlessness. So our legalism is really lawlessness,
Oh,
right?
wow.
But
Yeah.
they engaged in behavior. They took upon themselves to engage in behavior that they thought was going to fix what couldn't be fixed by them. Only God could remedy it. And that's kind of at the heart of addiction, is we're
Yeah.
trying to fix things and we're doing whatever we can to do it, but we're trying to fix things that only he can fix.
Yeah. Or promises. You don't have everything you really want, do you?
Right.
Like, that's
And
tell me that.
you want to be like God, don't you? I mean, he wants you to be like him. You want to be like him, don't you? You want the same things he wants, don't you?
Yeah.
Here, take this. And it's like,
Yeah.
man, the whole
You
thing.
want wisdom, don't you? I mean, you don't
Yeah.
have wisdom.
Right.
You want fun, don't you? You want to relieve this stress, don't you? I mean, it's just such a perfect narrative. Such
Crazy
a
stuff.
yeah.
And then
Let's
along come the wonders of figuring out how to distill spirits and make alcohol and find the wonderful effects of that.
yeah, I know. I
Crazy.
remember hearing about that. Like, wow, we call alcohol spirits. Boy, it really is. Not good ones, but
Yep.
it really is. I want to summarize then because we went in a lot of places,
Yeah,
but I mean, what you're talking about in terms of models, there's lots of models.
right.
And I think your basic point is it needs to be integrative because it's never all biological. It's never all psychological. It's never all social. What did I miss? Which one? And spiritual.
Right. So think of that old parable about the blind man and the elephant, right? Each blind man, and I know this is inappropriate language these days, but each blind man had a different part of the elephant. And if you said, "Tell me what an elephant's like," one would have described it as a wall because he had the side of the elephant. The other would say, "Well, it's kind of like a snake," and that would have been the person that
Tail.
had the trunk. No, it's more like a rope, and that would have been one that had a tail. Well, it's kind of like a fan, and that was one that had a. And so the
Yeah.
idea just popped into my head one time while I was trying to move further in my own understanding of all this stuff. Is they would have been right in their own perspective, right? That each of their truth, each of their experience from their vantage point, this is what an elephant is.
Mhm.
And so I thought, all right, what if all of a sudden God healed their blindness? And all of a sudden, all 5 of those people could now see the whole elephant
I love
and
it.
see what the others were also seeing. And then we said, okay, we do a little group work with them, right? Sit them down as a group and go, okay, now tell me what an elephant is. I wonder how their conversation with each other would be different because they now saw more clearly and with the capacity to see it from someone else's perspective.
Right.
That's basically where we are with addiction in these models. And one of my loudest messages is the problem is reductionism. Watch out for reducing things down to only or mainly only one of those dimensions.
Yeah. It's only a lack of God. It's only a disease. It's only because of what
Psychological
happened to
trauma,
you in the
right?
past. It's only
Exactly.
because you're bipolar, right? Did I
Right.
get all the quadrants? Like,
Right.
yeah.
Right. Rather than,
And
and look, some people will need to focus on one dimension or the other. So it's not that 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 being specific about these areas of someone's life aren't important. Sometimes they're very important. It's just that stay respectful and honoring and wise about this is the total person involved. We really are in such a good day now that if I stay out of the fights, and the theoretical fights and the professional turf war fights and the financial incentive types, if I stay out of all that mess and just here is this person in front of me that God has brought my way for care. What does this person need to get to where they need to go before him so that they live the way that he desires for them to live? Right.
right.
So Miller and Rolnick, these were the guys that developed this approach called motivational interviewing. They use the terminology. We need to give them a menu of options. And there is such a vast menu of options that are available for people now that we can draw from that menu of options and let them create an a la carte path for themselves. And one of the largest ones that isn't out there is the one that you have tapped into beautifully, and that is guided self-change.
Right.
People are
Yeah.
changing on their own anyway without guidance. Well, now you take self-change plus guidance, and you've got this kind of powerhouse thing going on.
Yeah, I am. I
Great.
needed help. I needed help. I needed community. I needed support. I needed learning. But I had a 40-year habit. But I am shocked at the amount of people that it's helping with simply the Facebook group and the devotional. I mean, I've got somebody on, I don't know if I shared this with you, but there is a review on Amazon that said he's been 3 times to rehab, and this was working for him. I
Right.
was like,
Yeah.
wow.
Yeah. And look, and who knows what all goes into that is why didn't the first one work and all that, and all that. Honestly, who cares? You know what I
Yeah,
mean? It's like, listen, thank God.
it is,
Thank
right.
God you're where you are, and I'm glad I could be a piece of that. You know what I mean? And I I
Yeah,
think it does though point to one of the largest gaps in all right. Uh, okay, so So this whole, remember I mentioned the Oxford group, a Christian evangelical group concerned about world
Yeah,
evangelism,
yeah.
and those are okay. All right. So imagine I end up knowing that somebody somewhere is bestowing gifts on me that are helping my life go better, and they're providing incentives for doing so and all that. Man, I'm going to be so thankful for that and all that. Compare that, but I don't know who my benefactor is. Now contrast that with knowing
Oh, I
the
know.
one who gives those to me, who loves me more than I can ever know, who knows me better than anyone else can ever know. And that's the one that's giving me these things, and that he has a name.
Right.
You
Yep.
see what I'm saying? Then
Yeah.
you get the power from the name of the one that created you in the first place.
Well, it's
Who,
such, and if
yeah,
you just look at what I'm doing, it would be, it's too much pressure to think that I'm doing it. I'm just being used as
yeah,
a
yeah, yeah,
tool, and I'm so grateful because I
exactly.
don't have to I don't have to be responsible for the results or the direction. He just provides the way.
Right.
Because imagine if I like took credit for this. It's just like, wow, I'd be crushed under the
Exactly.
responsibility.
In an instant, really.
Yeah.
And that's why I see it in essence, you kind of did yourself a disservice a little bit in that there's no way you can take credit for this thing.
No,
No,
exactly.
unless you want to have happen what you just described, right?
Uh-huh.
Since you
And
don't
I
want to
go
go
back
there,
to
well,
drinking and maybe add some drugs to
oh
it.
yeah, sure. Hey, maybe I can write a second book. Don't want to go there.
So I love the way you said that maybe somebody has to focus in one quadrant or another, like deal with that childhood trauma, or you have I mean some people do have a genetic
Oh,
predisposition,
sure. Yeah.
and that's
They
the
do.
harder thing to fix. Some people may have, and God have certainly seen this, they're missing God. And this
Right.
is what they find, right? There's just,
Right.
you're right. It has to be integrative. And that's the
And look,
point.
that's all okay too. You know, Paul at Mars Hill and the unknown God and all that. I mean, he didn't shame them. He said, "Listen, I can see that you're a religious people. Let me introduce you to him." You know what I mean? He didn't beat him up or shame him or whatever. Now he had his moments, but that wasn't one of them.
Yeah.
So, and that's really, you know, the arguments back and forth about, you know, the secular 12-step program. Well, they don't specifically mention Jesus. And I said, yeah, well, look at all the people that found him for the first time or found him again, you know?
Right.
Now, think somebody can say, yeah, look at who didn't find him because they thought they had spirituality. I get it. But look, maybe we're not the ones in control of that destination.
And there's a lot of
Yeah.
12-step things going on in the
Oh,
church too. And they're successful to an
right.
extent. And I'm still trying to navigate. I've been to a few Celebrate Recovery meetings. There's something about it that doesn't, for me,
Right.
because I know how many lives it saves. So I just really always want to be careful.
Right. Yeah.
um, but for me, it feels more living in victimhood than in, well,
Right.
it's celebrate, right? And
Right.
there are people that celebrate their quote
Right.
unquote
Well,
recovery.
and so, you know, it then kind of gets into how people look at and define recovery. And I know that term is problematic in a lot of ways, but if I've had some life distorting problem, you know, I may bear the evidence of that in my life. It doesn't mean I'm not healed. It doesn't mean I don't have a future. It just means, okay, this is what I'm left with. Right. And it's not that, you know, not everyone is completely or entirely healed from every
Oh
uh,
gosh, no.
problem that
As a
they've
matter
ever
of
had.
fact,
Yeah.
well, what I find is taking away the substance allows me to develop healthy mechanisms to deal with stress, disappointment,
Right.
evil, because I wasn't using healthy mechanisms to
And so
deal
and
with.
so and so if my emotional and relational and spiritual muscles never developed or atrophied, I'm gonna have to have a rehabilitation time to see how much strength I can obtain, how much health I can grab. I may not get to 100% of where I otherwise would have been.
Yeah.
Now, some are gonna get beyond where they otherwise would have been, and that's what I mean. That part's not under our control, and I think we have to be really careful not to judge folks based on consequences they still bear.
Oh, amen.
You know what I'm saying? So
Yeah.
so I use an example. I know people have different ways of responding to this, but one of the ways that I've been able to reconcile this whole disease model thing with this is think of type 2 diabetes, right? Let's suppose I had predisposing factors, but had I never made my own sinful choices, I never would have developed type 2 diabetes, right?
Mhm.
If I had have eaten well, exercised well, all that, no matter how genetically predisposed, I would have been fine. Okay. Now imagine that, okay, I made sinful choices and decisions, sins of omission and sins of commission. I didn't exercise the way I should and I ate what I shouldn't have. And now I've got type 2 diabetes. Let's suppose I wake up, I have a come to Jesus meeting, I repent, and I start to exercise and I start to eat well. Well, what happens when I'm still left with type 2 diabetes? Does that
Mhm.
mean I'm still in a perpetual state of sin?
No.
Okay. And see, in my mind, think of when you hit true addiction as a disease, when you hit true disease, think of it as an acquired disease, similar to type 2 diabetes.
Yeah, I like that. Although I'm not sure I like that because of the renewal of mind, but let's
Right.
stop there because
Yep.
this is such a good conversation that we're going to continue it into part 2.
Okay.
You
Great.
ready to do that with me, David?
Sure. Absolutely. I'll,
Awesome.
I'll do part 3 if you want to.
Ah, all right, we will you guys need to stay tuned for a further discussion on this where we're going to go into a lot of languaging and a big question of mine that I'm looking forward to David answering is, do you address the chicken or the egg first, which is the trauma or your inability to deal with stress or depression or something else? Like, which do you deal with, the substance abuse or the problem? Until next time. Thanks for listening to the Say Goodbye and Imagine podcast. If you like what you're hearing, give us a 5-star rating so that others can find us. And please subscribe so you never miss out on any brand new episodes. Go to www.theplanshehasforme.com today to get access to the 5 foundational principles to alcohol freedom. You will also find a link to purchase the daily devotional there. If you're interested in being a guest and sharing your story, email us at contactus@theplanshehasforme.com. Thanks for listening, and here's to you and your imagined life.